Dental implants have become one of the most predictable dental procedures and can accomplish a beautiful smile and excellent function. As with any medical or dental procedure, there are risks that need to be considered. With any work done in people's mouths, there is a small risk of infection at the time of surgery. A study done on surgeries done by periodontists found the infection rate to be very small, less than 1%. There is also a small risk of bleeding after the placement of the implant. This also occurs in less than 1% of patients, and these are typically people that take medications that influence blood clotting. Be sure to tell your periodontist about any medications that you are taking and if you've had any prior history of bleeding after a medical or dental procedure. There is a 1 to 5% chance that the bone will not heal around the implant. If this occurs, the implant is simply removed, and after a healing period, a new implant can be placed. It is possible to bump into the adjacent teeth. This is avoided by examining the x-rays or a special x-ray called a tomogram. These are taken for the purpose of showing where the other roots are and what the orientation of the root is. If there is inadequate space, the surgical specialist will tell you. The space can sometimes be increased with braces. If not, then an alternative tooth replacement technique should be used. When implants are placed in the back of the upper jaw, there is some risk to the sinuses. The maxillary sinus is in this area, and it becomes noticeable when we have a cold as pain under our eyes. It shows up on x-rays and on a tomogram x-ray or CT scan. The periodontist can then select an implant with a size and shape that will avoid the sinus. If the sinus cannot be avoided, there are techniques that can be used to increase the bone in the sinus area to allow for safe implant placement. This requires a high level of surgical expertise. In the lower jaw, there is a nerve that must be located and avoided. This nerve is most easily located with the three-dimensional tomogram view. The periodontist will be able to show you where the nerve sits in relation to where the implant will be placed. A safety margin is built into the planning to avoid the nerve. Because of the modern X-ray equipment, trauma to the nerve is extremely rare. These are the most common risks and complications associated with dental implants, and it must be remembered that each of these are rare. The periodontist will be able to discuss your specific risks and answer any questions that you may have during the treatment plan and consultation.